So much, ma'am.
Speaker, Poornima Prabhakaran, who is the Deputy Director of Public Health Foundation of India. So over to Dr. Poornima, because I know you are in a hurry. You go ahead. I think you've been already introduced to many of our Foxians during your last webinar, which was very, very informative.
Good evening, everyone. Thank you, Dr. Ramani, for the introduction and for the invitation and the opportunity to interact with the esteemed members of FOXI yet again. At the outset, happy World Environment Day to all of you. It's my privilege to be a part of this e-conclave with such enriching deliberations and interactions so far. So today I'm going to be talking about a slightly different and a very recent concept, climate smart healthcare and role of the health sector in addressing climate change. So just to set the context right and to bring us all on the same page, I will divide this into two parts. First, set the context a little bit and then lead you on to this concept of climate smart healthcare. So why are we all talking about climate change? Is the biggest public health challenge of the 21st century, but it's also the biggest public health opportunity of the 21st century. And we are increasingly seeing news headlines like these in recent times, more so in the last few years. Today, we know that in India, we are standing in the midst of heat waves. We have seen floods happening, not one, but two locations. Air pollution has become ubiquitous. And it's not just, Greta Thunberg was mentioned a little while ago, but even our children here in India are recognizing that this is a huge crisis and they want us to sit up and take notice. So what are the impacts of climate change on human health, as well as on the entire ecosystem that we all live in? The impacts due to rising temperatures, extreme weather, rising sea levels, and increasing levels of carbon dioxide has impacts on every domain that we know of, from degrading our living conditions, changing vector biology so that we are seeing more and more vector-borne diseases, air pollution, and impacts on water. We've heard lots of discussion today about it, so I will just move on from here. But just to talk about a little bit of the challenges that come from climate change for public health globally. So from now, between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths from malnutrition, from malaria, from diarrhea, from heat stress, all the acute climatic events. And it's going to be a huge cost to us to the scale of something like $2 to $4 billion by the year 2030. And there's no surprises here when we say that most of the impact is in the developing countries. And India, with large parts of our country still having weak health infrastructure, will in general be more vulnerable. And already we are seeing that there's a high social and economic cost, and this has come from recent studies that have shown that India is ahead of countries like US and Saudi Arabia in terms of the social and economic costs to us from climate change. So the implications of climate change for India cannot therefore be understated. So just to get us all on the same page, what is actually causing this climate change? So on one hand, yes, we have the heat from the sun, the solar radiation is there. But on the other hand, there's also something called the infrared radiation that is emitted from the Earth's surface. Most of it is absorbed, but some of it is reabsorbed by gases here in the atmosphere, lower layers of the atmosphere, called the greenhouse gases. Many of you would have heard the term greenhouse gases and the greenhouse effect. And these greenhouse gases tend to keep the temperature of the Earth warm, and the more carbon dioxide and greenhouse gases, the warmer the temperatures are. So in terms of greenhouse gases, the commonly known ones, the significant ones, are just water vapor, carbon dioxide, methane, and nitrous oxide. And the biggest culprit is carbon dioxide, because it tends to stay in the atmosphere for thousands of years. And this is one of the most important reasons for climate change. So who is responsible for all this carbon dioxide emissions that are happening into our atmosphere? Again, no surprises. If you look here, it's the developed countries of the world that are emitting more carbon dioxide. But the paradox is that the health consequences are mostly felt in the developing countries. So it is serious cause for concern. If we go to actually the sectoral emissions, carbon dioxide emissions come from a number of sectors. It could be from the agricultural sector, it could be from the electricity and heat production, that is the energy sector, industrial operations, we all are familiar with this cause, transport, and building and construction activities. What about us? What about the health sector? Does the health sector have a role in these emissions of carbon dioxide? And do we need to care? And the answer is actually yes, which came from very recent work. There was this groundbreaking work that was done by the global organization Healthcare Without Harm, and the healthcare's global footprint from its own climate footprint was pegged to be something close to 5% of the global emissions. And just to set that, give that a perspective for you, it is equivalent to emissions from about 500 thermal power plants. That is the equivalent of emissions from the health sector from around the world. And if all the healthcare facilities in the world were to be put together and ranked according to countries, the healthcare sector would be like fifth in the ranking. So we would be the fifth largest emitter of carbon dioxide on this planet. And that is not a good thing for a sector which is supposed to be delivering care if we are also causing harm. So where is this emission coming from in the health sector? A large part of it you can see here. This is our health sector's footprint, our climate footprint. A large part of it comes from our heating and cooling and the use of electricity. So the energy sector is a huge contribution. But there's also just from our healthcare operations, there are emissions of carbon dioxide from our transport, from our food, from the pharmaceutical products, as well as the medical equipment. And when we talk about the goods that we procure in the healthcare sector, we are talking about the entire life cycle of these goods and equipment. So from the production of the pharmaceuticals and the medical equipment, right through the supply chain, delivering it to our hospitals, we use them there, and then we dispose of them. So the entire life cycle has a carbon footprint. And we all know that India is the pharmacy of the world. We produce the active pharmaceutical ingredients in huge quantities in our country. And the environmental impacts of those production activities are also something that we should take account of. So in terms of ranking, again, it is India is among the top 10 emitters of carbon from the healthcare sector. This is a very different concept which we never think about. We all study to become doctors and are delivering healthcare, but we never think about, has our sector also contributed to something like climate change? This is just the figures for India's healthcare sector's climate footprint. It is in the range of 39 metric tons. That's huge footprint. Again, just to put it in perspective, it is equivalent to the emissions from about 10 coal-fired thermal power plants, or even easier to imagine, it's like the emissions from about 8 crore passenger vehicles on the road. So Indian healthcare's climate footprint is also huge. And much of that actually comes from the procurement of our medical goods and pharmaceuticals, apart from our own healthcare activities, the delivery of healthcare itself, all the operations within the hospital has a carbon footprint. And this actually triggered off some action with the Paris Agreement that occurred in 2015. And there was an agreement from not just other sectors, but also an agreement that the healthcare sector should also be mobilized to cut their carbon footprint and to become a climate leader for this. And action for this has started. We've heard of Greta Thunberg, but also our own health sector colleagues from around the world. This is actually colleagues from Bangalore. One of the hospitals recently joined the climate strike that happened in September last year, a call for action from Greta Thunberg. But all the healthcare professionals around the world also sat up and took notice that the climate crisis is an existential crisis, like Ricky Cage mentioned earlier, and we all need to sit up and take notice. And like I mentioned earlier in my previous occasion when I addressed you, the health sector voice is very important, and we need to stimulate action across the board from all our colleagues. So moving on actually to this part of the climate smart healthcare, what links climate change and healthcare? There is now increasing recognition of the impacts of climate change on health. I spoke about that earlier, and all of you are aware of it now. Climate change has impacts on a lot of health outcomes in the human body. There is therefore going to be growing dependence on our healthcare services. And we need to be aware of that. We need to have the knowledge that climate change is going to have health impacts, and we need to have the infrastructure to handle that growing burden of diseases. So are we prepared? So this part of being prepared with the healthcare facilities to handle the growing burden of climate change is one aspect of becoming climate smart. And we recognize that climate change strikes at the very core of health systems, our mission is to keep people healthy, but climate change can affect our health systems itself. So these are images, very disturbing images. This is from the Chennai floods in December, when healthcare facilities were inundated and had to move out patients at very short notice. Similar scenes from other parts of the world, Puerto Rico, Hurricane Maria in 2017. And this is, again, similar scenes from California wildfires in 2019. So in a sense, climate change is an equalizer. So it affects healthcare systems around the world. So we have gotten together as a network of healthcare professionals around the world, steered by this organization called Healthcare Without Harm, who has set up a global green and healthy hospitals network. And this is close to 36,000 hospitals and healthcare centers around the world. And we lead the initiative for them in India through a platform for advocating for a global plan for climate smart healthcare. And I will just now move on to explaining to you what exactly is this concept of climate smart healthcare, but how we are planning to do it through our health and environment leadership platform, the India arm of this global network, through which we have, as of now, 72 members, associations, hospitals, laboratories, accreditation bodies across India, representing the interests of about 7,500 hospitals, and who are now the voice of health sector for environmental issues in India. The challenge I face over here is that this is the scale of the Indian healthcare system. You all can identify yourselves in some part over here of the Indian healthcare system. So the public healthcare system, which has state hospitals, MCD hospitals, ESI hospitals, the Ayush dispensaries. Then you have the tertiary care like the All India Institute of Medical Sciences, medical colleges and hospitals, the CGHS dispensaries, going down to district, community and primary healthcare centers and the sub-centers, which will now become part of the Ayushman Bharat. The Ministry of Defense has its own vertical with its own base hospitals. The Ministry of Railways has its own hospitals, and many of you probably also fall into this private healthcare sector of multi-speciality hospitals, private clinics and nursing homes. So multiple systems of medicine, and how do we make a change across the board with all these parts of our Indian healthcare system to become climate smart is the challenge that we have today. So And just again, a grim reminder of what the scale of emissions is from our Indian healthcare sector. It is in the range of something like 2 crore metric tons of carbon dioxide. So we thought about a year ago, how should we start this? So we started with sensitizing the healthcare sector by hosting a national conclave on health, exactly this topic that you're asking me to talk about today, on climate change and role of the health sector. This was last March, and we talked to representatives of all these organizations about this existential crisis. Ricky Cage, as you can see, was with us as another voice from his end. And we started talking to people and sensitizing them about the role of health sector in climate change. And this led to the government recognizing us as a center of excellence to feed into their national program of climate change and guide them in this concept of climate smart healthcare. So this is where we start talking about the 2 pillars of climate smart healthcare. One is resilience. We need to become a resilient health sector in order to handle the growing burden of health impacts due to climate change. And on the other hand, we also need to mitigate our own climate footprint. So these two are the major pillars of climate smart healthcare. So resilience, which speaks about a climate prepared health system, and mitigation, which speaks about a decarbonized health system. So we have to lower our carbon emissions. And how can we do that? And why do we need to do that? We are the first responders. The healthcare sector has to respond to acute climatic events, whether it's due to heat stress, whether it's floods. Healthcare facilities are expected to be the last building standing in any of these acute events. And we're expected to deliver uninterrupted care. So we need robust infrastructure in terms of our buildings, in terms of our energy. We need to become adept to tackle all these growing burden of health outcomes that climate change is going to bring upon us. And this is the concept of resilience. And there is actually a definition by WHO which speaks to this concept of resilience. A climate resilient health system is one that is capable of anticipating, responding to, coping with, recovering from, and adapting ourselves to climate-related shocks and stress, so as to bring about sustained improvements in population health. So this entire concept of resilience is for our health system to become aware and prepared and anticipate these acute climatic events. The other concept is the mitigation that I mentioned. And this is, the health sector is largely represented by blue. So we talk about greening the blue. We need to go green. And this is not a new concept in the Indian healthcare system. We have something called green hospital standards already that is there, that some of you may have been following in your hospitals. But this needs to be scaled up in a big way. And the reason being the reasons that I've already mentioned. We have a huge carbon footprint. We are like the 5th largest emitter on the planet. And much of this comes from our supply chain as well as our hospital operations. So we need to move to a pathway of sustainable production, sustainable procurement of all our procurement of hospital supplies should become green. And we should also dispose of our waste, not just the waste that comes from the medical devices and the pharmaceutical products, but also our water, the food waste and electronic waste. Whatever we use in healthcare operations has to be disposed of as well in a very sustainable manner. And this is the concept that speaks to mitigation or decarbonization of our health sector. It includes healthcare, hospitals, health systems, and the health product supply chain that paradoxically are contributing to emissions from the entire life cycle of their operations. Hence, we as healthcare professionals have a responsibility to adopt sustainable, low-carbon solutions to mitigate and reduce our climate footprint. And together, these two concepts of resilience and mitigation, there's often an overlap in the measures that we have to take for these two concepts. They combine together to build what we have defined now as a climate smart health system that can adapt to deliver critical healthcare services in the face of climate change. And this is going to happen in the next few years. We have to be climate prepared, and we also have to decarbonize our healthcare. And there are 7 key elements that were defined a couple of years ago, again by Healthcare Without Harm, commissioned by the World Bank. So the UN agencies have already recognized this as a threat that is coming upon us. And so the 7 key elements of climate smart healthcare include overall system design for coordinated care, emphasis on local providers, and driven by public health needs. A hospital or a healthcare facility in one part of the country may not have be driven by public health needs that are comparable to another part of the country. So some parts may be vulnerable to floods, some parts may be vulnerable to heat waves. We need to be cognizant of all those public health needs. Second is building design and construction. You use low carbon approaches in designing your buildings. Green buildings code is something that has already been recognized in India. And this is something that has to be adopted by healthcare facilities as well. Green hospital buildings and green hospital standards. Investment in renewable energy and energy efficiency. We've heard this mentioned before in some of the earlier talks. Transition to renewable sources of energy like solar energy. We have no dearth of that in our country. thankfully, we need to leverage that and move in a very sustainable way to renewable energy, even in our healthcare facilities. Energy efficiency, not just for the electricity, but also we should buy medical equipment that is really energy efficient from production to disposal. Waste minimization, sustainable healthcare waste management, sustainable transport and water consumption policies, as well as across the board low carbon procurement policies for pharmaceuticals, for our medical devices, for food, as well as other products, and resilience and preparedness, which I've already mentioned. So this was a document which has now become like the Bible of climate smart healthcare, which was produced by Healthcare Without Harm for the World Bank and for WHO. And we have, our leaders have been working across the board. These are Dr. Margaret Chan was WHO Director General, Maria Naira, who was quoted earlier in one of the presentations, and Mr. Josh Carlina of Healthcare Without Harm. Our own presidents, Mr. Dr. Srinath Reddy, have all been advocating for this climate smart healthcare from just not even like 2 to 3 years ago. But this is a concept that needs to be instilled in the minds of all our healthcare operations. And people are doing it across the world. So this is an example of using solar for vaccine transmission, cold chain transmission, and other parts of the world as well. Powering health with low carbon solutions and moving towards universal health coverage in a very equitable way. And so our Center of Excellence is now feeding into the National Program for Climate Change and Health and helping the government. Definitely that will lead into the public healthcare system adopting these concepts, but hopefully we will also be able to change the way private healthcare is also functioning. And these are the various dimensions that we will be hand-holding them into implementation for. There are various dimensions of climate smart healthcare, from selecting your hospital site to your building and infrastructure, through your resources, the water, the energy, the food, waste management, transport, communications. All healthcare facilities should have their own climate action plan, be linked to climate information services. We are blessed in India to have an Indian meteorological department that is able to give forecasting. So all hospitals should be linked to climate information services so that you can have your own preparedness strategies to handle increasing burden from climate change. Human resources, of course, are important stakeholders across not just doctors, but also nurses and all the other healthcare professionals, laboratory managers. Awareness to handle the disease burden, so capacity building required across the board. We need leaders across, from the smallest healthcare facilities to the national level. We need leadership to move our healthcare system on a decarbonization pathway for the next few years. And of course, it requires money, but this could be only startup costs. Even if you're doing a simple thing like changing your bulbs and your lights to LED lights, it's a change to energy efficiency. There might be some capital cost to it, but in the long run, your returns will be good in terms of mitigating your climate footprint, but also your returns in terms of costs. And definitely the whole concept of climate smart healthcare requires intersectoral coordination. Our work spans from primary healthcare centers to mid-care hospitals. These are examples from the ground. This is a primary healthcare center in India, which has transitioned already to solar panels. And this has shown that inpatient and outpatient outcomes have improved just by increasing their energy efficiency. So a lot of case studies have been documented of front runners in healthcare in India who are moving to climate smart operations. And we will be talking to the government and developing an implementation plan on all of these aspects, from site selection to building an infrastructure. So how we use our natural resources, waste management, transport, climate, all of the aspects that I spoke to you before. And you actually are getting a preview here to that implementation framework. We have for each of these domains that we have talked about for climate smart healthcare, we will be having a plan to handhold healthcare facilities provide them toolkits on how to work for their climate smart healthcare mobilization. So from site selection to building design, I'm not going to go through all this, but just to say that all of these are actually a blueprint for action for moving to climate smart healthcare. So building design, how to manage your energy, water, waste, how to procure sustainably. So there's a suggestion of establishing a green procurement committee, a green team for your facilities that will oversee sustainable procurement of all that you need for your healthcare delivery. And linking to climate information services, awareness and capacity building. And I mentioned earlier the National Health Conclave that we hosted last year to begin this sensitization and awareness building. We developed a position paper on this to present to the government on the role of health sector and climate change, which we luckily managed to submit to the Union Minister for Health. So where there is political will, there seems that there can be a way. So that's just a first step, but we cannot move on this decarbonization pathway with the Indian health sector without partners like each one of you on the ground. So this is like my first reach to the members of Foxy community. Please come on board with us for this important initiative. And hopefully we can convince you that climate smart health systems is the smart strategy for future healthcare. Intersectoral coordination is key, but we will be happy to guide you through this path. And I will finish there and look forward to interacting with all of you in the coming months and years on the approach to climate smart healthcare.
Congratulations, excellent.
Dr. Poornima, that was an excellent talk. That is actually an eye-opener, how we people are generating more of this garbages and this, how we need to have an impact upon the climatic changes. You have enlightened us very well. And I think you are one of the persons who had helped me a lot to make this webinar a grand success. Thank you, Poornima, and hope to see you soon.